Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for tuning in to my latest video. It's of a patient who attended with a discharging left ear. They had been experiencing excruciating earache for the last 2 to 3 weeks, contacted their local GP who prescribed olive oil earwax spray, believe it or not, over the phone. And the patient themselves felt as though they had a perforation because as soon as they put the olive oil earwax drops into the ear, it stung. And also when they were performing the valsalva, so when they were closing their mouth, pinching their nose and blowing, they could feel pressure coming out of the eardrum, which would only typically happen if you've got a perforated eardrum. Now, what was unique about this particular case is that the patient actually had 2 perforations in the eardrum. I've never come across that before. And you'll see that in a moment. So I've suctioned out the majority of the occluding pus, the outer ear, and now I'm just using a fine end gauge and I'm right up towards the eardrum here. And the larger of the 2 perforations are now visible. You can see that to the right. And just where I am now, there's a smaller perforation. So the patient's experiencing glue ear, otitis media with effusion, so a middle ear infection where there's been a buildup of fluid. That's eventually got infected and thick and viscous like glue, hence the name. And this is built up behind the eardrum in the middle ear cavity. Eventually it had to go somewhere, so it's perforated through the eardrum. The eardrum itself is also infected. We call that myringitis. You can see just how red and thickened the eardrum is. You can just see the hammer bone where just on top of the suction probe where I am now, so that's quite inflamed. The patient was experiencing a slight caloric effect because their middle ear was exposed. When you suction in there, the ear temperature reduces, which then inhibits the organ of balance in this particular ear, the left ear, which then sends mixed messages to the brain, different messages compared to the patient's normal right ear, and therefore the brain thinks you're moving but you're not, and the patient's experience vertigo, feeling the room spinning around, and it soon settles. So I'm just using a fine end gauge just to mop up near the entrance. I'm sorry for some of you who are watching the video that I'm actually breathing whilst talking, because I've had a few comments where people I'm not even allowed to breathe anymore whilst narrating, so it is a bit hilarious, but I just thought I'd mention that because it was in my last video where a couple of really unnecessary warranted comments, but I took a deep breath before starting this kind of commentary. Anyway, I'm just mopping up this discharge, so it's now kind of almost pouring out of the ear. You can see that it's crusted. I wrote a letter to the patient's GP. They need some what we call non-ototoxic medication. Most ear drops, antibiotics, are what we call ototoxic. So if they enter the middle ear, i.e. via perforation into the inner ear, it can cause permanent hearing loss and deafness, and also other symptoms such as vertigo. Therefore, when I've written to the patient's GP, I've made it explicitly clear that they prescribe either oral antibiotics, which may help, but if not, and they want to use prescribed ear drops, non-ototoxic medication because of the patient's tympanic membrane. I've also requested an onwards referral to ENT because I don't think the patient's quite elderly. I'm not sure whether this perforation will self-heal, and the patient's been advised to not use the olive oil drops anymore and also to avoid water entering their ear. So that's just a zoomed in, a close-up of the perforation. You can see it's active, it's wet. In a moment you will still a still image. There we are. So you can see that these perforations are both posterior, so the bottom part of the eardrum. One's in what we would call the posterior inferior quadrant, so bottom right, and the other one, the posterior anterior quadrant, so bottom left. So I hope you enjoyed that video, guys, and you're all keeping well and safe. I shall speak to you soon. Take care, bye.